Hi ladies, Paula from Yummy Mummy Physio. So I'm having a chat to you today about the pelvic floor and our vulva and vaginal area. So we're going to go through today just a little bit about the anatomy and physiology of the area, and I also want you to get to know your lady bits a little bit better. So the first thing I want you to do is just have a think throughout your life of how you thought about that whole vaginal vulva area, the sacral chakra, if that's what you'd like to call it. Might sound funny to you, but is it something that you were aware of growing up? What sort of language was used around it? Did your parents refer to it in a certain way? Do you have a name for it? Is it something you're comfortable talking about? Have a think about whether you've had a look at that area since you've had a baby. Have you had a feel of that area? Even right down to the point of women masturbating. Some people masturbate, some people don't. It's very much a taboo topic for women, which is really interesting, isn't it? So I just want you to have a think about where you're coming from when we're talking about this kind of area. The second thing I want you to do before we dive into everything is just have a think about what your birthing experience was like. So whether it was a vaginal birth or a cesarean, it might have been an emergency cesarean, might have been instrumental birth, so forceps or a vacuum delivery. Did it go how you expected it to go? Sorry, my dog's here growling at me. Was there trauma involved? So are you feeling a bit traumatized by the birth, or have you walked away having a really positive birthing experience? Because that all makes a really big difference to the way we view our lady bits post-birth. I should have locked her outside. I do find often, I'll always ask women in my clinic how they perceived their birth to be, because sometimes it's not a question that's been asked before, and I think it's a really important question, because if you've had trauma to any kind of area in your body, you absolutely get a disconnect between yourself, your soul, and that particular area, and that is absolutely the case for our pelvic region. So if you've had a traumatic birth, you may feel completely disconnected from that area. Or if you've had gynae issues in the past, if you've had endometriosis, if you've had fertility problems and lots of fertility treatment, then you might think of that area in a completely different way. So just take a few minutes. You might even want to pause this video now, even get a pen and paper and jot down anything. Just do a big brain dump, whatever comes to your mind. So I want to know, was it a good experience? Was it a traumatic experience? Are you sexually active now since having your baby? Have you got any pain down there? Is it feeling weak? Is it feeling floppy? Does it feel different to you than it did before, or does it feel exactly the same? Do you have a name for it? Anything you want to ask. Have you had problems with intimacy and intercourse since having babies, or does sex feel more painful since having babies? Anything, whatever you want to ask. But if you've done that, let's delve straight into it. And I want to just quickly go through the anatomy of the area. So just to orientate yourself to the pelvis. This is a side-on view of our pelvis, so I hope you can all see that. But basically we've got our pubic bone here at the front, this bony part here. We've got our urethra where we pee, and our bladder. Then we've got our vaginal entrance and our uterus here. Sometimes the uterus can be retro-tilted, which means it's flipped back the other way. If you've got a retro-tilted uterus, you're actually more at risk of pelvic organ prolapse. So that's something that's interesting to know. They should be able to tell you that when you have an internal assessment or a pap smear. I can often pick it up because the position of your cervix is in a slightly different position. Then we've got the anus here and the rectum that goes straight up that way. So the pelvic floor is this red part that attaches from your pubic symphysis here, the pubic bone at the front, and it goes all the way back to the tailbone at the back. This red part here is the external anal sphincter that obviously tightens around the back passage there to keep us fecally continent. So if you're looking inside the pelvis, the pelvic floor is like a sling or a hammock shaped that way. So the opening where my hands are is where the urethra, the vaginal entrance, and the anus all come through the center. Now, your first exercise is I want you to get yourselves a mirror and you're going to have a look at your bits. That might sound completely terrifying for some of you. You may have never done it in your life before, and some of you will have already done it. So what we're going to do, here's another picture. So we're looking straight up the center now. So if you've got a mirror and you're having a look, this is what we're looking for. So you've got, again, first hole is the urethra up the top. Sorry. The middle part is the vaginal entrance. The back part is the anus back there. So first thing I notice when I'm having a look, doing an internal assessment, is I will check out what the opening to the vaginal entrance looks like. And obviously just condition of the skin, if you've had episiotomies, tearing, things like that. We can take a little bit of a look at that. One thing we'll notice is usually if you have never given birth vaginally, the entrance to the vagina is a lot more closed. In general, this is not always the case. If you've given birth vaginally, particularly a couple of times, that entrance to the vagina does usually sit in a little bit more of an open position. What we want to look at then when you're doing a pelvic floor squeeze, and I won't go into that so much today because we've talked a lot about how to do a pelvic floor squeeze and a lift and how that's related to your deep tummy muscles, your transversus, and your breathing muscle, your diaphragm, and the coordination of that core working synergistically together as a unit. But when you are doing that exhale, squeeze and lift of your pelvic floor, what you should see when you're looking with the mirror is that vaginal entrance should start to close, and that whole vaginal perineal area around the anal sphincter should close up and lift. We want to see that it holds up as you're holding your pelvic floor. When you release the pelvic floor, we want to see it drop back down and open up. So it should be a definite squeeze and a lift up, and it should be a lower. So that's how our pelvic floor functions, and we engage the muscles, they squeeze and lift, and we should be able to let them go back down. So again, jot that down on your pad with your notes from today's little session. Have a look about whether you think that entrance to the vagina looks open, closed, any kind of comments you want to write. There's no right or wrong. I just want you to be aware of your own bits down here and become a lot more connected with them. The next thing I want you to do is have a feel internally. So we've got quite a few different pelvic floor muscles, but just simply speaking, we've got our most superficial muscles, which are the ones that really are sort of a circular muscle around the vaginal entrance. What those muscles do is they're like a sphincter and they close off. So I want you to put 1 or 2 fingers up inside your vagina, just as if you're inserting a tampon, and I want you to do a squeeze, and I want you to let me know, can you feel a squeeze? Can you feel that you can squeeze and hold? Can you feel nothing? So just make a note of that. Also make a note of how many fingers do you think you can comfortably fit up inside the vaginal entrance. So is it just 1, or do you feel like you could fit 3 or 4 up there? So just have a bit of a think about what that feels like. So does it feel like a sort of a tight entrance, or do you feel like it's quite open and gapey? There's a really big range. There's no right or wrong. Again, we're just becoming aware of what your own body is like. The last thing I want you to do is have a look at the deep pelvic floor muscles. Now, to feel those, we've got pelvic floor muscles on the right and the left side of our body. So when you're feeling internally, what I want you to do is pop your finger straight up inside the vaginal entrance. If you were to push back, you'd be on the bowel. So sometimes you can even feel that there's fecal matter in your bowel. So it's best to do this after you've emptied your bladder or bowel. It's just a lot more comfortable. So I want you to pop your finger up inside the vaginal entrance and come over to each of the sides. First thing I notice is what physios refer to as tone. So tone is a word that's used in the general public, and we're often using it in the sense of, I want to tone up, I want my body to look toned, which doesn't really make sense to us physios, but we know that all you're saying is you want your body to look lean, so you've got less body fat, you know, your muscles are more defined. But tone in its true sense with muscle is how firm a muscle feels in its resting position. So if we're putting our finger up inside the vaginal entrance, popping over to one side and almost pressing down a little bit, so you're putting that pelvic floor muscle on a stretch, I want you to do the same thing where we take a breath in, exhale, squeeze and lift the pelvic floor, and you should feel that muscle actually lift up. Those muscles are called your levators because they lift up and elevate. So we want to feel, again, it lifts up, and we want to feel if those muscles can hold that lift position, and then we want to feel if those muscles are able to relax back down. So again, a proper functioning pelvic floor can squeeze and lift, it can hold, and it can lower back down. I then want you to pop over onto the other side and see if it feels the same. So can you feel that squeeze? Can you feel the lift? Can you feel it lower? You might find one side's weaker or stronger than the other side. In some cases, you might find one side's just not working at all and the other side seems to be working fine. You might struggle to feel it on both sides. The other thing I want you to pay attention to is any sensation changes. So do you feel like one side you just don't have that same awareness of sensation, or is one side more painful compared to the other side? So again, jot all those things down on your notebook, and then if you've got any particular concerns, then we can talk about it next time I see you. So that's all we're going through today. So go off and do those exercises, and I look forward to hearing how you go. Thanks, ladies.